Okay, well, I see people joining, but I know there are many people here already. Looks like climbing close to 100 right now. Welcome. I'm the Executive Director of the National Women's Health Network, and this is Raising Our Voices in a Time of Racial Injustice, Health Disparity, and COVID-19. If you're not familiar with the network, I'd like to share a little bit about our mission. We improve the health of all women by giving women the knowledge they need to get the healthcare services they deserve. We change policy, we support informed decision-making, and we save lives. Healthcare is a human right, and the network is committed to standing up for the health of women in all their diversities. Finally, and maybe most importantly right now, we understand that there will be no health justice without racial justice. I could tell you so much about the network's work, but I want to hurry up and get to the program. I'm as eager as you are to hear from our panelists. Let me just say right this minute, our wonderful staff are working on a range of crucial issues, including providing in-depth analyses of the disparate gender and racial impacts of the COVID-19 pandemic. We're speaking up for a strong FDA, and we're providing people with information they can use to evaluate whether a new vaccine truly passed the test. We're challenging the legacy of Jim Crow racism and pushing for equal eligibility for Medicaid in all 50 states. We're fighting to do away with the FDA's medically unjustified requirement that pregnant people travel to pick up abortion pills that they can safely take at home, a requirement that is landing hardest on low-income and women of color, who are also those most affected by COVID. We're continuing to hold Johnson & Johnson accountable for its decades-long practice of targeting Black and Latinx women with marketing of a product that they knew it was dangerous. We're encouraging everyone who can to hurry up and vote. And we're encouraging all United States senators to slow down and not rush to confirm a nominee who passed Trump's litmus test to overturn the ACA and AIDS. So there's my introduction for people who joined midway while I'm talking. I'm Cindy Pearson. I just welcomed y'all. And now I'm going to turn it over with actual honor and love to the moderator of this event, Dázon Dixon Diallo. Dázon is the founder and president of SisterLove, the first women of color-led HIV/AIDS organization in the South. Dázon is a visionary and a renowned advocate in the struggle for human rights and sexual and reproductive justice. She and SisterLove fight against HIV with and on behalf of communities of women and girls living with the disease and those who are at risk for HIV and other STIs. And not only is Dázon a well-known activist, she's also a media personality, having hosted a weekly radio program focused on Black women called Sisters Time for more than 23 years. Dázon?
Hi, Cindy. Thank you so very much. And by the way, as a child, I grew up in Stillwater, Oklahoma for a few years. So I've been to a few rodeos, but I've been on radio much longer than that. So thank you for
both
that.
Of your parts.
Absolutely. Thank you so much. And I am so honored and excited to be here today. I'm looking forward to moderating this incredible conversation. In 2020, the COVID-19 pandemic has laid bare the failures of our health system and the inequities of a democracy that should protect and provide an equal and just health care system. For women of color, especially Black women, low-income women, and undocumented women in all our gender diversities, none of this is new. With all that has and has not happened in this year alone, these issues have penetrated the national consciousness in ways that we've never seen before. And it's time for health, gender, and racial justice activists to seize this opportunity. Today, I'm partnering with three amazing, in my own words, I would just call them super soul sonic sisters, but three amazing women to talk about just that. Joining me today are Byllye Avery, who has been a healthcare activist since the early 1970s when she co-founded the Gainesville Women's Health Center to provide respectful abortion care and an alternative birthing center. Byllye also founded the Black Women's Health Imperative, formerly known as the National Black Women's Health Project, the only national organization exclusively dedicated to advancing health, equity, and social justice for Black women, and the very first women's organization that I actually joined as a member. And in 2007, she joined with the network and the Women's Health Program of Community Catalyst to co-found Raising Women's Voices. We also have Dr. Terrilyne Cole, who is an experienced physician with expertise in infectious diseases, epidemiology, prevention, global health, and healthcare management. At the beginning of the COVID-19 outbreak, she realized that many people turned to social media for information and innovatively began to use multiple platforms to provide trustworthy, thank you, information to the community at large. And my sister, Marsha Jones, is the co-founder and executive director of the Afiya Center in Dallas, Texas, and a Raising Women's Voices regional coordinator. Marsha is a grassroots organizer, community mobilizer, and health educator who has led successful campaigns to convince Texas policymakers, we continue to pray and meditate for your fights, Texas policymakers to address the crisis of Black maternal mortality. I'm going to get us started with some questions, but please feel free to ask your own questions in the chat. We may get a chance to answer it during this event. So I'm going to start out with this one right off the bat. How has COVID-19 exposed the racial disparities within our healthcare system, and what can we do about it? A second question will be, the network understands that for women, health justice and racial justice are connected. In your experience, personal and professional, how have these two struggles connected? And what does your work look like in the age of COVID? How has it changed? So once we have a conversation, we're going to move now to our sister Kalina. I want to take a break from the conversation first to talk about a special campaign. Did I skip? Let me just start with that. I'm sorry, I'm reading too far ahead. Let me back up and start with our questions. I'm going to start with the first question, and if there's someone who wants to speak up and pipe in on the first answer to that question. I'm going to start with, how about Dr. Cole?
I got it.
There you are, yes.
With this pandemic, I think more so than anything else that I've experienced in being a physician is how for Blacks, Indigenous, Native peoples, Latinx, Pacific Islanders, how structural racism has led, to this inequality of access to social and economic resources. In particular, high quality education, gainful employment opportunities, high quality healthcare, safe physical and social environments, and healthy food. And I think we were talking before we came on about how isolating this virus is, not just for the folks who actually have it, but also for those of us who are trying to treat people, and that most of us are now doing a lot of telehealth and telemedicine. And I think I often get, especially when we began this whole thing back in March, and people were battling a lot of myths, which still continue to flow through social media about, and initially it was Black people were immune to this, and then it was a variety of things that have gone and have been debunked, but still there was a reason for, I think that people were afraid. They were trying to come up for reasons for why this was happening, and fear tends to push people into those directions. But then some of these messages started coming out that, because we started seeing, especially in Illinois, these the disparities in the number of cases and the hospitalization rates and the death among Black folks and brown people, that Black people were now getting blamed for why we had it, right? So that it was because you had diabetes and you had high blood pressure and you had heart disease and you had kidney disease, and all of those things were your fault. And because of that, those led to people having difficult times if they got this infection. And the messages that I started seeing were that folks who were considered social influencers or celebrities or sports things were giving lectures to Black and brown communities that we needed to be doing better things for ourselves, taking better care of ourselves. And I don't have a problem with trying to improve our health care, but the fact that it was being blamed, or the belief that, you know, our immunity was affected, our immunity to this virus was affected by our behavior, and there's not evidence for that. Where's the evidence that, you know, that this was taking place? I think there's a lot of anecdotal behavior. You see somebody who doesn't have a mask on, you see somebody who's not social distancing. But what I kept finding was that those things, when you saw one Black person doing it or one brown person doing it, it was attributed to not just that individual, but a whole group of people. So now Black folks aren't wearing masks, we're not social distancing, we're having parties, we're doing all those things, and it's our fault now because now we did those things. But, you know, majority populations don't have that same requirement to prove that they are doing it. And the assumption is if this person's not wearing a mask, that's on them, not a whole group of people. So I think that this has become, the infectious nature of this is not just the infection itself, but the beliefs about being poor and being a person of color and being a woman, and how those things that are so rooted and go back hundreds of years in this country that simply can't be erased by this, and that therefore they have to be addressed. Like, I think that the country has gotten to the point where it has said, okay, enough. I mean, HIV wasn't enough. Young women dying while being pregnant and having infant mortality rates, none of that seems to be enough. But now it seems like people are ready to have this conversation about how that's not enough, and how integral structural racism is, and how it's biologically compounded in generations of people. And we're seeing that now. I mean, it's ever more clear to me.
I agree. I completely hear you and agree with you. I was thinking about our own experiences of having to deal with a pandemic right in the middle of also literally an uprising for a lot of different reasons, and that there are still continuing pieces that are popping up in different communities in different ways, showing that the anti-Black racism and racial injustices are almost at the same level of pandemic needing response as the COVID crisis itself. So in that context and in that situation, Marsha, you're in one of those big cities that also has a lot of Black population. How has the COVID-19 crisis exposed the racial disparities in the healthcare system right where you are, and what kinds of things do you think we can do about it, or what are you all doing about it?
So I'm in Texas, in North Dallas. I mean, not North Dallas. I'm in Texas, and I'm in North Texas. And North Texas is by population the largest region in Texas. So we are not large as Houston in square feet, but in population. So there's 2 million more people in North Texas than in Houston. So, and between Houston and Texas, Houston and Dallas is probably roughly 45 to 50% of the entire population in Texas. So I'm saying it to say this state have the highest uninsured rate.
Mm-hmm.
And in that highest uninsured rate, this is before COVID, Black folk, and especially Black women identified folk, carry the burden of that. And of course, immigrant folk. But when we're looking at it that way, and so what COVID, I can't even say COVID have exposed that, because we knew this. But then I'm saying we know this as a person that's inside of this space. So maybe the choir knew it. And so what COVID have done is brought the conversation to the congregation. And so people are literally seeing the impact of not having health care. And so COVID is, so right, like right now we have a huge community spread here, right? So people are at home, and folk inside of their houses, you know, so COVID infection is being spread inside of communities, inside of homes, inside of all these spaces. And where do people go? And so we're seeing that, and the rate is growing and growing and growing. And so we're having to fight a lot of fights here. So there's racial unrest here too. There's people not having access to health care. There are women who are being penalized going into the healthcare system to have babies. Scared to go into the healthcare system because nobody can be there with them. We are fighting this governor we fought this governor tooth and nail at the beginning to not open the state, and they opened it anyway. This is a very red state. I don't even believe we are magenta. This is a very red state, and the fight here, it really don't stop. So it is impacting us greatly because we literally at the Afiya Center are the folk that we serve. And so we have people who we are fighting for to have access to health care, you know, and I'm trying to struggle to get monies that I didn't have and discretionary dollars so that I can assist people with paying for their health care or some kind of health care plan, kind of a system we have where people donate to it inside of the space, and then the little money that we get so people can have access. We get women who are accessing abortions very late anyway. We serve Black women, and they are usually always very late in gestation. That's another conversation. We've been talking about that in the space. COVID have made that even worse. And so now women are almost being forced to go full term with pregnancies that they did not intend to go full term with. Because by the time we can get them, by the time that they can get in, by the time that they get to a clinic, you know, and that's because of some of the such misinformation. So there were people who were still thinking in July that abortions were, the clinics were not open. And so we're having to fight misinformation. We are a very on the ground organization. So we've had to pivot to being virtual. Well, most of our folk don't even have access to this. So it's the fight for us. Of course, we have to keep grinding. We have to keep it on the ground. We've created ways to talk to our community. We've opened up our space so that there's ways in which people can come in that don't put them at any kind of risk. We changing some monies around so that we can help folk with their rent, so that we can get folk into the hospital, so that we can do this. And in the meantime, we are virtually training up folk so that we can be ready to hit this legislative session in the next couple of weeks. And we're making sure that people are getting to the polls to vote. And so those are the things.
Let's be clear about that.
Yeah.
Yes, getting to the polls to be counted and completing that census because we count.
Oh yeah, and the census.
Yes. So thank you so much for that. And I wrote down that we brought the conversation to the congregation because I think that we're coming back around to that in just a few moments. So Byllye, same thing. You were actually talking about some of what's working where you are. But let's talk about the racial disparities in the healthcare system in terms of what you see and what we can do about it.
Byllye, you're going to see a pop-up that says, ask you to unmute.
Okay, good, thank you.
That's okay, Byllye. You
I'm
know what I call that?
sorry.
I call that
Yeah,
I call that a selfie mic check. So as long as you
Right.
sound like yourself, we're all good. Go right ahead, sis.
I'll tell you, one of the most shameful things, I think, is to live in a country that's supposedly to be as wealthy as we are. Some people are wealthy, most of us are not, and not have access to health care. I don't know how people can even fix their lips to say that you should not have health care. This is something that they should be able to identify with, because we all get sick. We all have diseases. We all have everything. We have uneven income. Absolutely. The part of what has made this so hard for Black folks and people of color, which we started calling ourselves people of the global majority, because we are people of the global majority, is that racism has always been here. And while the United States was going around saying that we have the most advanced and the best healthcare system in the world, it does not matter all the experiments you do and all the little discoveries you can come up with and all of that. If I can't get it, you don't have it, as far as I'm concerned. And so you take countries like Africa and other countries that don't have the quote unquote wealth we have, but they have a much better way of getting health care to all of their people. And they, first of all, believe that all of their people deserve access to health care. So let's just start right there. The fact that we don't have access, we don't have systems in place to do any of the work that COVID sort of dictated. It would certainly have no leadership, no national leadership on that. They have absolutely no idea, and neither do they care. And so it's just been really compounded. It's no surprise to me that they don't try to attach this disease to a population. Remember, you used to call it the Spanish flu. Nobody thought about how did the Spanish people feel about it being called a flu, and then wanting to call this the Chinese COVID. I mean, you know, we are all people. Things happen. And so I think for almost every outbreak, people try to tie it to some nationality of people to dig in with their xenophobia. So that still rises. I think the convergence of these several pandemics, there are several of them happening here, is that the earth is saying, let's have a time out here. Whoa, let's slow this down. You all need to take a break. You know, I know the climate is glad that we are not out there every day messing it up, and for like a month or so, it could breathe. It could catch its breath. Our money has never been right. We have Black folks who are considered essential workers. These are the people who make the lowest wages. These are the people who had to get up and go to work in the midst of the pandemic. And then think about those areas where they didn't even have protective gear for them to wear. And they working in hospitals in garbage bags and all this kind of thing in this quote unquote wealthy world that we live in, wealthy country that we live in. So what it has done is this pulled the dress up so that everybody can see what's under there. That we've been saying was under there all the time. It's no surprise. You know, they always say white people get a cold and we get pneumonia. And that's not because we are most susceptible. That's because we don't have access to whatever it takes. You know, and the fact that over 210 or 15 million people have, 1,000 people have died is just a travesty. And it didn't have to be this way. In the beginning, we kind of thought it was going to be like Ebola, you know. But you know, they took care of Ebola. It didn't get out of hand. But we have no leadership, and I think that's the big difference. And people are sick and tired of this. And the young people are leading us, and they saying we're going to clean up this whole thing all at one time. Going to take care of all of it. And so that's what I think is exciting, and that's the place I go to say that we're not going to let up, and enough is enough.
That's right. That's right. Thank you so much for that. I'm loving that if I can't get it, you don't have it. And that is not only about healthcare, that's almost across the board when we're talking about equality and equity and equal justice and the whole thing. So I'm going to stick with you, Byllye, on our next question, which basically we've sort of gone into already around the connectedness between issues for women, health justice, racial justice. But in your own experience, how, you know, even if we're in a storytelling moment, short stories, is how have these two things, or how have these two or three struggles actually connected in terms of your own personal professional experience?
Well, as I look at the way that we are treated, the fact that we start out way behind the line, and that in order to succeed, you got to be not only better than everybody else, you got to be like 20 times better than everybody else. And then even when you get there, somehow you're not good enough. So you get reared all the way from the beginning, knowing that we have to fight, all the time. We are never allowed to forget that we are Black. There just is no space for you to think about something else other than race. And no matter what comes up, you have to do the racial analysis around it all the time. And you hear people say, all they want to talk about is race. Oh, well, because it determines every single thing in our lives in this country that we live in. And so some of us would like to take a break from it. And the way I mean, you look at all of the injustice in terms of the criminal justice system, all of the people who are locked up, all of the people who have been lost, the fullness of their lives because they've been behind bars, most of them for nothing that they had anything to do with. You look at who will save us, you know, who is for us? The police departments, the right wingers have integrated all of the police departments. They've stacked them, and that's where they're hanging out. And that's why you see all these senseless crimes. Not all of the policemen are that way, but they need to root out the ones who are. And here in Massachusetts, they're talking about a certification process like you do for doctors and nurses and occupational therapists and all them. You have to be certified and take a test every so many years to see if you're still able to serve. So the racial injustice is just multi-layered. And there's no part of us that it doesn't touch. It goes all the way from the earrings in our ears to the clothes that we wear, to the food we eat, to the health care we can or cannot get, to the money that we don't make. People work hard and make nothing. There shouldn't be a word called the working poor. That term should not even exist. So all I'm saying, Dázon, is you name the spectrum, and it is penetrated.
There you go.
Just a disease.
Thank you. So, Dr. T, we have a Dr. T at SisterLove, so I'm going to call you Dr. T. If you wanted to chime in on that, I think you actually beautifully laid that out, especially from a provider's perspective of just in the patient care world, how you see these things connected. Tell us your story in terms of how you see these struggles connected for you.
I sigh. But it's a good sigh. It's a good sigh. I think seeing people that look like me, taking care of people, and bringing messages of this is real, and let me tell you why I know this is real. And I think as my philosophy is being a physician, being a woman, my entire thing is about being able to build trust and relationships with people, because my job as a physician is to be able to break down very difficult things and topics and ideas to help you understand your body, and then present all the options that you choose from. And then whichever you go through, whichever you choose, I go with that and I document that. And I make sure that your healthcare wishes are followed, whether it's an outpatient setting or an inpatient setting. And I think with this particular pandemic, I'm now focused on telehealth and trying to transmit these trust issues across a camera, and recognizing that I've had to get in my car and go make a home visit because people didn't have adequate internet access. They didn't have a laptop. They didn't have a smartphone. They didn't have a camera. And those things impacted my ability to be able to take care of them. And those were things that they could not help. And it reminded me very much of when I first started taking care of HIV patients, and my patients that were professional sex workers, and my patients that were coming in and out of the prison system, and just the need to be able to say, I know you are getting all these messages from social media, from television, from family, from church, but I'm going to tell you what I know to be the science behind it. And I need for you to listen and to be able to ask me questions, because I want you to walk out of this door with a good understanding. And if you don't, then I need for you to keep asking me. I need for you to keep saying and believing it's okay to ask me that same thing over and over and over again. I'm a physician that draws. I draw to help people understand their organ systems, to what viruses look like, all kinds of things. And this being behind a camera, being over a phone, has hampered that. And it's hampered my ability to be able to teach. And I think as physicians, part of our responsibility, that what we should be doing as healthcare providers, not just as a physician, I think our responsibility is to educate people. I mean, that is what we should be doing. And I don't know if that's necessarily taking place. And a lot of that, especially now, because the relationship, the interpersonal relationship, the in-person relationship is so different now. And you're not able to see those people in your office. And you're not able to check folks and say, wait a minute, sit back down. Because I can see right now you are disgusted by what I said, or you're disillusioned, or you're unhappy with that, or you don't want to talk to your case manager, or whatever it is. And those are things that are vastly different for me. And as a physician, I'm having a hard time. I worry when I don't get that FaceTime call back from a patient that I'm managing at home who has moderate COVID disease, and under any other circumstances, this person qualifies to be hospitalized. But we don't have room. And I can't send that person to anybody else. I share in this vulnerability of this deadly infection, you know? And so it's not a situation of I'm making choices about sexual partners or anything like that, or I'm drinking, or I'm using needles, or I'm doing nothing like that. This still carries a stigma. And it's that stigma now that I'm concerned because it's going to be a pre-existing condition for the people that I take care of. And that's affecting all of us, absolutely every single person of us. And I know Billy mentioned the need for PPE. And I think that, and I also think that Marsha talked about some of this too, being able to to have armor, to be able to deal with people appropriately. Listen, healthcare provider burnout is so real behind this, because if you're wearing a same N95 mask day after day after day, I developed horrible acne earlier when I was going to see patients. It was too much. And I kept thinking to myself, I'm not even in the ER. I'm not even in the ICUs admitting, and I know my colleagues are dealing with it. And so the seriousness of how our country has done such a terrible job of diverting financial resources for people who are on the front lines and essential. And a lot of my patients who are uninsured or underinsured are essential workers and frontline workers, and they don't have the luxury of, I get this virus and I get to stay home. I get this virus and I can't go into work today. I lose my job. And the fact that so many of my patients live in multi-generational homes, that when one person gets sick, there's one bathroom. So there's not like they can be cordoned off in the household and stay in their room, and that they have enough dishware, cookware, that this can be set aside for while this person is still infectious, and that they're not having to share. I mean, those are real things. I mean,
and yet we have I'm sorry, because I'm going to move on to the conversation, the next part of the conversation. But what you're saying is so critical, because what we have in what Byllye was talking about in terms of a lack of leadership is we have the exact opposite messaging coming about how easy this is, and don't let it, don't let it overpower you, that kind of thing, as if it's individuals' ability to fight this virus on their own. It's just not real.
No.
So I'm going to quickly move over, because before my roommate, who's on 4 legs and paws, takes over this conversation, I do want to acknowledge that both Marsha and Dr. T, that you have answered a couple of the questions that were coming in through the chat, both about how are we dealing with people who don't necessarily have access routinely to the internet. Both of you have responded that in the chat beautifully, as well as talking about how caring for people living with HIV brings reminders, and how this actually reminds you of some of those critical issues. And I want to thank you for that. And other people said that they have doctors who draw too, so they really appreciate the way you educate. So I'm going to take a break from this conversation so that we can talk about a special campaign that the network has co-founded called Raising Women's Voices for the Healthcare We Need. To talk about it more, I'm introducing you now to Kalina Murphy, who is a network staff member and works directly on the Raising Women's Voices campaign. Kalina, welcome to the conversation.
Thank you. Hi, everyone. Thanks for joining today. As Dázon said, I am a member of the network, and I'm the Senior State Advocacy Manager for Raising Women's Voices. So we were co-founded in 2007 by the network, the Black Women's Health Imperative, and the Women's Health Program of Community Catalyst. Raising Women's Voices, also known as RWV, is a national initiative working to ensure that women's voices are heard and women's concerns are addressed in the fight for universal health coverage. Our mission is to engage women who are often not invited to the health policy conversation. So we're including women of color, low-income women, immigrant women, young women, women with disabilities, and members of the LGBTQ+ community. Through RWV, we have defended and strengthened Medicaid and the Affordable Care Act. We've expanded Medicaid to ensure that low-income women and their families have affordable insurance options, regardless of where they live, and build support for policies that advance health equity and address affordability and accessibility barriers to care. Through RWV, we have 25 amazing organizations that we work with across the country, also known as RWV Regional Coordinators. The regional coordinators enhance the on-the-ground organizing and have enabled RWV to build an active and informed network of women health advocates. Together, we all contribute to RWV's expanding network of informed, passionate, and tenacious activists. And to continue, I'm going to turn it over so you can hear from 3 of our regional coordinators and the role RWV has played in their organizations.
Hi, this is Julie Warden, the COO at West Virginia Free. Raising Women's Voices has given us the opportunity to make a big impact on healthcare in a state that needs it most. They give us the tools to educate people on important health benefits information. Through their funding, we are able to make sure people are enrolled in health insurance and have actually worked to decrease the number of uninsured West Virginians by over 60%. We've been able to work with policymakers to expand Medicaid, particularly for pregnant individuals, and they always equip us with resources to keep people informed on federal policy so we can help others take action. Without Raising Women's Voices, we wouldn't be able to continue this important work, and we know how important it is now, more than ever.
Hi, my name is Sarah Finger. I am the founder and executive director of the Wisconsin Alliance for Women's Health. And I just have to say that without the Raising Women's Voices project, the collaboration, the sisterhood, the connections, the insight, we have a small but scrappy organization here in Wisconsin taking on great big policy battles that impact women's health, safety, and economic security. And it was a no-brainer that our organization should be addressing healthcare reform and making sure that Wisconsin women's voices were heard in that debate. So I just thank you so much to everyone involved with Raising Women's Voices and everyone who's invested in Raising Women's Voices. It has been a game changer for our organization. You've allowed the Wisconsin Alliance for Women's Health to be a true player in this discussion around healthcare reform, and as it continues, you keep us in this fight. And I just want to quick add that because of my role with the Raising Women's Voices as a regional coordinator, I was actually honored by the Obama White House as a Champions of Change for the Affordable Care Act. So I owe so much to the Raising Women's Voices team, and I thank you so much for your support.
Hi, I'm Dominica, and I'm the field coordinator at the Colorado Organization for Latina Opportunity and Reproductive Rights. In response to COVID-19, we've had to completely change our organizing efforts, and this year in Colorado, there's a proposed ban to abortion care after 22 weeks that's going to be on the ballot for voters to vote for on November 3rd. And this proposed ban to abortion care has no exceptions for complications or to protect the pregnant person's health. And we're working really hard to defeat this ban while also still social distancing. So we have hired 10 phone canvassers, and we're using paid auto dialers so we can increase our outreach. And we have also started hosting these Zoom events where we bring our community together and educate them about the abortion ban and voting and done that. So thank you so much.
Thank you. Now joining the conversation is the network's executive director and RWV co-founder, Cindy Pearson. Cindy, since establishing RWV in 2007, what would you say is the accomplishment you're most proud of?
Starting to break down the racial inequality and access to healthcare. You know, we didn't get nearly far enough, but we made a big difference. But then also I would say that, you know, working with the regional coordinators, it really depends, because what works really well for Marsha, a regional coordinator in Texas, might be really different than the regional coordinator transfer Pueblo in Arizona.
Definitely. I work with our regional coordinators based in the predominantly conservative South. So obviously wins for them are completely different from wins from their northern counterparts. But what their needs are completely different from the significant barriers that we face across the country.
And that's why we need the help of all our supporters. Raising Women's Voices is mostly funded through foundation grants, and they're very generous and committed to this approach to improving women's health care, you know, building from the grassroots up, led by RJ organizations in many cases, but we need more, you know, so we're asking you for support. You know, support that we gave today will go right with our, you know, technical assistance right to regional coordinators and projects like Marsha's and Dominica's and the West Virginia folks. So if you can, please give. Oh, yeah. I'm supposed to say donate.nwhn.org/raising.
Yes, like I said, you've heard from these amazing regional coordinators, Marsha, Dominica, Sarah, and Julie. Please donate. Go to donate.nwhn.org/raising to support now. The link is also available in the chat. And I'm going to turn it back over to Dázon for part 2 of this event.
Thank you so much, Kalina and Cindy, for bringing the voices of Raising Women's Voices, as well as for bringing us new information about the campaign. And again, I just want to remind folks that you can support the campaign at donate.nwhn.org/raising. donate.nwhn.org/raising to support them now. So I'm going to jump right back into a couple of questions, especially relating to the conversation from Kalina and Cindy about raising women's voices, because Marsha, the Afiya Center in Dallas is also a member of Raising Women's Voices. Can you talk about your experience as a regional coordinator?
The experience that we've had with Raising Women's Voices have really been a game changer for our organization. We're still a small organization, but we were extremely small when it was myself and some volunteers. I mean, that was the organization. And we were, I've said that earlier, but we were literally the people that we were trying to serve. I was literally a person working every day, 60, 70, 80 hours a week. I didn't have access to health care. I didn't, because I had transferred money over from when I was in corporate. So I had just a little too much to be a part of the healthcare, the Parkland healthcare system, but I did not have access. I also could not access outside of private healthcare because I couldn't afford it. It was just a mess, but we were working to make sure that people had access to healthcare. And my fight with making sure that people had access to healthcare literally was just transferable skills from the organizing work that I was doing with HIV, because it was literally the same folk in a sense. And so to have, I believe I met Lois at a meeting and they were talking about this. And like I normally do, if you're talking about Black folk, you're talking about my state, I don't know who you are. I want to know who you are and why you're not talking to me too. And so that's kind of sort of how it happened. And so we had the mini grants or the micro grants changed. It literally changed us. It put us on a different platform. People could see the work that we were doing. They could hear the work that we were doing. We were organizing people on the ground around what access to healthcare would mean. And then those folk, these became transferable skills that these folk went somewhere else and got jobs doing the same work. So it really changed who this organization is. And it didn't just stop with those micro grants to do the work on the ground around expanding Medicaid. But one of the really huge things that helped us was the Women Against the Grain grant. That was the thing that literally turned it around for us, because we knew how to do the work on the ground. We were organizers. But there were some things we were missing, like some infrastructural things that needed to happen.
Tell us a little about Women Against the Grain.
So Women Against the Grain is a fund that supports small organizations like the Afiya Center in the South with the infrastructural things that they need in order to expand their capacity and expand their work.
That's important.
Technical capacity building, or small grants to do infrastructure building, like building our board. If you didn't have a website, if you didn't have your C3, all of these things were put in place. And not only were we given the money for it, but we also, like I said, got the technical assistance to make these things work. And so we were like right there on the bench, like right there. And so we had some of these things, like we had our C3. We kind of sort of had a board. I didn't know anything about raising funds though. And thank you, Byllye. Every time I go to the room now, I tell people, hey, you can donate. You can donate. We had absolutely no people donating to us. This year, we had our largest single donating. We raised over $40,000 in yeah, I know you would love that, Byllye, in single donating. And now look what our developer have to work with to build our donor bank. Exactly. These are the things that happen. And I wouldn't have been able to do that had it not been for Raising the Grain. So now I've gone from being this organization with me and my amazing volunteers. I've hired many of my volunteers, and we now have a staff of 14.
Fantastic. That's amazing. I'm going to just take it just one next step, Byllye, in terms of how Raising Women's Voices plays a role, looking across a couple of specters. The Black Lives Matter protests that have kicked up a notch or two or five in 2020 have people talking about the experiences of Black folk in this country in a different way. I've heard it, I'm in it, I get it at my radio station. It's even in all of our conversations, comes through when giving lectures, even at predominantly white institutions, or with folks in the corporate sector who are still trying to figure it out, how to make this thing real and practical in their own workplaces. Can you talk about the historical significance of this and how Raising Women's Voices actually plays a role?
Well, you go back to when slavery ended and realize that Black folks been working on trying to be free for a very long time. And the way things are going, we're going to be working on it a very long time. And so doing different decades, different parts of us carried a load. In the 60s, it was Martin Luther King and I Have a Dream, Now we got Black Lives Matter. This will evolve and keep growing. They keep growing one on top of each other. Not really, evolving like all these concentric circles that are going around that are interconnected, that we're getting smarter and smarter and smarter about how to do the work. I watched the brilliance of Black Lives Matter unfold, but everybody had a mask on. Everybody was outside. Everybody was taking all the precautions. And this is protesting in a different way. And they've also reached out and figured how to make this thing, make white people start talking and dealing about their own racism and owning the problem that is theirs. It's not ours. And really saying you need to educate yourself. So I live on Cape Cod, and it's pretty liberal out here, especially the little town I live in. But I feel good when I can walk downtown. Almost every single store has Black Lives Matter sign in the door. And you can go in and have a conversation, and people are not just having a sign out there, like that's the end thing to do. People are carrying on and talking and beginning to talk about how racism affects their lives and how they didn't know. Folks didn't know until they saw George Floyd get killed. I don't know where they were when Trayvon Martin was shot. I don't know where they were when all of those other things happened. But people wake up at a different time. And so now we got a whole bunch of people awoke because we've got this thing in the White House that is getting more and more dangerous and becoming a super spreader by the day in everything that he does. And so you got the racism and the white supremacy so big until you got to be blind not to see it. You might say, okay, I see it, but I'm not going to do anything about it. But you can't say you can't see it. You can't say it's not there. And people are doing an excellent job of putting it out there and putting it right in people's faces.
I like that.
And I remember we had the, back in March, I think it was like maybe early April, they were having a march here. I was kind of scared to go because I'm 82 years old and I don't want to be getting nothing. They worked it out so we could drive our cars.
Yes.
And we got there. I was absolutely shocked. There were all these white people talking and carrying signs about white silence. And so somebody was saying, they don't let the black people, we've been talking all the time. It's their time to talk. They the ones need to be talking. They need to be talking to themselves. And we tell people, go talk to them people in your family.
Yes.
Those of you, your sisters, your brothers, your uncles, your grandfolk, you need to talk to those people. And they need to identify and talk about racism and the roles that they play. So I think that this is a real different kind of time, and the struggle is going to be long. There will be, it will be many, many, many more years. But what I can say about the civil rights built a platform that allowed Black Lives Matter to grow, and Black Lives Matter is building a big platform that will allow whatever that next thing is up there. Some of us won't be here to see it, but it's going to continue.
Yes. I love how what's happened is without apology and with a greater sense of comradeness, not just allyship, but building more comrades. People are finding their way to learn how to center Blackness.
Yes.
And I think that that's what Black Lives Matter has brought differently from what we experienced with the civil rights era, which is it's all right to look at the least of these, the most entrenched upon, the most disenfranchised, along with our Native and Indigenous brethren and sistren, that it's all right to center, as Congresswoman Ayanna Pressley, one of your congresswomen, says and always says so eloquently, is that we have to continue to recognize and make the way so that the people who are closest to the pain are the people who are closest to the power. And you start by centering those people. So I hear you and I feel you on that, Byllye. And I think that centers us on, we're going to switch your question up a little bit, Dr. T. We had a question about how do we build enough trust to encourage and empower COVID prevention among communities of color, especially when the collective trust is so eroded right now. I mean, I know a lot of people are focusing on this vaccine mistrust era, but there's also just a mistrust of the information, of the reality of this pandemic, of what we get when we get into the healthcare system. Can you talk a little bit about how you deal with those issues?
That is so tough. And I know that the vaccine thing, I think, to me, my research when I was in infectious disease fellowship was with the HIV Vaccine Trials Network. And I looked specifically how to engage Black and brown people and gay and lesbian and transgender and queer and non-binary people to buy in and want to participate at phase 1 level. And I had to have these conversations repeatedly, and we still need to have these conversations about what happened at Tuskegee all those years, what it really was about, why there was even a whistleblower, and I think when I mentioned about how generational traumas can affect your physical and your mental health, those things, that what happened to them, people then, still is very much at the forefront of why folks don't want to come see people when they do have access, or why they wait. And so the message has been a lot in the media that we need to have celebrities, and we need to have subject matter experts, and we need to have notable people take up these messages and embrace them and take them out there. And I have no problem with that. But it needs to be everyday people who are looking like us, who say, I'm an ER nurse. I'm a case manager. I'm a director down at the Boys and the Girls Club. I mean, it needs to be a lot of community engagement. It can't just be Dr. Cole said, blah, 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 okay? Because there's only so many people that trust Dr. Cole who know Dr. Cole, right? No, it needs to be everyday people that are saying, this is my experience with this. And I think the sad thing about this is that with this infection, you can't go into homes, you can't go into ERs, you can't go in hospitals to bring those faces. So what you're seeing are the faces of people who are surviving, because there are millions of these people, but they're not talking about what's happening to their lives as a result of what they've had. You know, some of it is they're talking about, I've lost my job, I've lost my business, I've lost my insurance, because in this country, insurance, good insurance or decent insurance is always tied to the workforce, which should not be. And so trust is always going to be at the forefront, I think, of anything to get people to listen. There's such a campaign of disinformation out here, whether it's influence from Russia or China or Iran or wherever it is. We have our own homegrown disinformation here that's rooted in conspiracy theories, and that it seems like every conspiracy theory, from people who believe that vaccines gave you autism, for folks who believe that you can get COVID over 5G communication lines, to people who still doubt that HIV is here, which is absolutely ridiculous to me, because it is here and it is going nowhere. Same thing as this virus. And I think that conversation like what we're having now puts a face and puts a needed voice to what's happening. And that the fact that this particular virus is tied to all these other pandemics of racial inequality and wanting to have equity and justice. Because I think if we don't know the numbers and the disparities, right, of the numbers of Americans tested, the hospitalization, the numbers of who recovered, the numbers who have died, the numbers who've had severe infection within communities of color. If we don't know those things, then we can't sit up and have good conversations about disparities, and we can't talk about fixing policies that reinforce the disparities that exist. And only way to be able to get equity and justice is to be able to do that. And so just to kind of sum all of this up is that we need to have more discussions like this with more people in more sectors of our communities talking about this. Yeah, it's nice to have folks who are out here who are notable and who are seen, but I don't relate to John Legend. I don't relate to LeBron. I don't relate to these people. I want to see people who look like me. I want to see people who look like us. And I think it is, and going along with what Byllye said about this whole Black Lives Matter thing, I think is just reinforced that, listen, marginalized folks are here. We're not going anywhere. And if now ever more so, you've got to deal with us, and you've got to deal with what has been ingrained into what it is, what people pride themselves off of being American, being able to have freedom of what you want to say and expression and all of those things. And yes, you know, as a Black woman and as a physician, and wanting to be a part of protests and be seen, and, you know, I think that connects some people to, okay, you're regular people, you're regular folks. And I know it's hard. Like, folks look at physicians and they think that we are these people that know all the answers, which we don't, and that some of us have God complexes, which we do. But we are, when it comes down to it, we're the same folks. We're also facing the same microaggressions. I've been called a nigga physician, I don't know how many times. About to say 2 months ago, I was called colored over a telehealth visit. And I had to say, and they said, it was essentially this: Dr. Cole, I didn't know there were colored physicians out here who did infectious disease. And I said, what color are you talking about? You know, so it's like, I think when you're able to insert yourself, when you're able to insert yourself into what you see this is, and have these conversations. I've lost colleagues and people I thought were friends over this whole entire Black Lives Matter, and being able to say, so what you're saying to me, because I protest. And I already know when you participate in protest, when it's organized, you're wearing a mask. You're bringing vinegar, you're bringing milk, you're bringing a backpack. You're already having your phone numbers down on a piece of paper, who you're gonna call if you get arrested. You do all of those things, and it has absolutely nothing with burning down your community or burning down anybody else's. And so the reason why we're able to say a lot of these Black Lives Matter protests that are going around are in fact not spreading virus, is because one, we're already masked up and we already have clothing masks and eye protection, because that's a part of what you plan to do.
That's right.
And I think that, trying to lump peaceful protests about healthcare, women's health, all of the things that are coming out through Black Lives Matter. And I am so infinitely proud of young people for being able to do it. But all of us have a part in that. And I give kudos to my white colleagues, to my Asian friends who are recognizing where they are in their own privilege, who are facing it with their own families and kids, because these are difficult conversations and we need them. We need them to have those conversations, because it's not our job to teach people not to hate. They learn how to hate without us. We can't sit up here and teach you not how to hate.
I could have this conversation with y'all all the day long and then some. I've been instructed to come back to a question. And so thank you first and foremost. There's so many kernels that came through that. I do want to respond because I think it's very important. There was a comment that came into the chat just about it because you raised Tuskegee as an issue. And I think that's important because I'm the one, I think, who raised the fact that it's not just about our mistrust of what's going on right now with the vaccine technology, all the way to, sister candidate Harris, who talked about how she's going to trust the scientists. She's not going to trust, the super spreader to give her any information about the vaccine. And I could get with that. And there's a question that came directly for me, and it ties a lot into what you were saying, Dr. T, around how does the issue around COVID remind us of HIV prevention and care, what kind of lessons we can learn. Well, even then, when we were talking about, just as you were saying, getting Black folk and brown folk engaged, and whether it was the treatment trials, I'm a part of that same vaccine trials network that you're talking about, from that, doing that Be the Generation, getting the community research literacy elevated and all of that. And the conversations would always start with Tuskegee, but where it never finished is what we benefited, what we learned, and what Tuskegee's exposure has done for us, right? So it always stops with the victimizing of Black folk in that, and doesn't move forward and saying, first of all, the whistleblower was Black. Let's talk about that. And then let's talk about the fact that what happened was not just that the whistle was blown, but the entire research enterprise throughout the entire system was completely galvanized, and was completely spun over into this level of accountability that the network has had an opportunity to play a role in, that ACT UP, I'm an old ACT UPper, that ACT UP had a moment with, and that we have been able to create even the conversations about the way the research and our engagement happens, even now in the era of COVID. So it has always been important for us as a community to learn the science, to translate it into our own language in our communities, but to also recognize how the fight in and of itself changed things. And that's where I think we have to go, is that there are not enough people. And what I do love is that the conversation is not only about COVID, but what COVID has allowed us to do is broaden this conversation about equity in healthcare. And that the equal justice in the healthcare system and the system strengthening. You hear healthcare system strengthening when we're talking about healthcare systems in the developing world or in the global South, or in countries that do not have the same level of economic privilege that our Western countries have. But we have a healthcare system strengthening deficit right here in the United States, this COVID issue, that HIV, that Black maternal mortality, that even the fact that in the dark of night, people can do forced hysterectomies and sterilization on our sisters who are in detention, that all of this is because we don't we're not in the streets in the same way. And I think the connection between this issue around health justice and racial justice in the era of Black Lives Matter and COVID-19 vis-a-vis what we've learned from HIV is giving us that next wave of opportunity to take to the streets around our healthcare, around our bodily autonomy, around how the people make decisions within the FDA, within the NIH, within HHS, all of these health agencies that have the authority and the responsibility to make sure that our systems are strong for everybody. That's what I think makes me the most proud to be a part of the network, but also to be in this conversation with y'all today. This is fire. I mean it. And that's about what I do hope. I know that people are giving us a few extra minutes. So what I want to close on, and I'm saving this chat because there's so many great conversations coming from folks, and I'm loving seeing the people that are on our call today. I want to give everybody, let's say, if you don't mind, maybe about 30 seconds or less, if you have a closing thought, if you have, and I do radio, so I'm gonna have to keep it to that, but that if you have a real short thought that you want to close out with in terms of either, let's just go with what you expect to see. Let's think forward now that we know what our challenges are. We pathologized this for a good hour plus. Let's put some visioning. Let's bring some future into our present and talk about what we might expect to see on the other end of this. I was on listening to the fabulous lecture this morning sponsored by UNFPA, and even they are talking about Build Back Better. It's not just a nomenclature for a campaign right now. I think it's really an aspiration for how we come out of this whole set of pandemics. Let's talk about how you think we're going to build back better. I'm going to start with you, Marsha. 30 to 45 seconds. Go.
That's all it's going to be because I have another call. So I just wanted to say this, and so much amazing stuff has been said. So I'm not even going to add to that. And I've wanted to say this here. I want to say that one of the things I saw happen, that I'm seeing happen during COVID, that is going to be a part of how we build back better, is the brilliance of Black folk. Folks starting businesses, entrepreneurship started. I have a whole line of folk that I buy my potions and stuff like that from. I'm shopping literally with Black folk. The amazingness that I seen through this, like Black folk persevered. We did what we do. And there was a sense of entrepreneurship that started like something I have never seen before. And I want to see us build on that. That is a thing that I hope that we can build on as we move forward and into recreating what a world can be. One of the things I said to folk on my social media when states started opening up, I said, now don't forget who's been holding you down through COVID. Don't forget who's been delivering you meals. And I'm not talking about the folks that worked at these large chains. I'm talking about the people that was cooking food in their kitchen. I said, don't forget who's been making your clothes for you and your head wraps and your face masks. Keep shopping with those folk throughout this, because our dollars make a difference, and our dollars will make you turn around how you see us. So that's what I wanted to say in leaving. A whole lot of stuff have happened through this, but some brilliance happened inside of this with Black folk, and entrepreneurship took on a whole different turn.
Thank you. Thank you.
Go
Dr.
now.
T. Thanks, Marsha, and thanks for joining us.
Bye, Marsha. So this is what I always have been saying from the beginning, and I'm going to keep saying this because I think this is integral, and I'm coming from being a teacher physician. I want more women that look like us to get involved in healthcare some kind of way. I'm not saying you need to go to medical school. I'm not saying that you need to be a biology teacher. I'm not saying you need to be an EMT. I just need for more of us to become involved in the educating of more of us to become healthcare providers and be involved in healthcare advocacy and social justice issues. And so in doing so, I think we become more literate, we become more knowledgeable. And in doing so, this gets to where I want us to be involved in both the planning and the delivery and the participation of clinical trials, of ethically done randomized clinical control trials. We've got to be a part of that. We've got to be in there. And as women, I want us in there developing models, you know, not just within pharmaceutical, not within the FDA, not just in NIH, but brilliant ideas come from community.
Yes.
Okay. And
Yes.
I think that being able to engage folks to do that and encouraging people, you know, I argue with people all the time in good faith about why it is important to see people that look like us involved in research, because it gets to the very heart of where we are about participating in vaccine trials for HIV, for vaccine trials for any of this stuff.
That's
and
right.
Particularly now for when these mixed messages have come out, and who are we going to trust in terms of which science we're going to look at? And do we have to have groups of Black and brown physicians reevaluate every piece of science that comes out to be able to translate the message? I mean, it's a lot that's coming from this, and I appreciate that. But my thing is, I need for people to ask the questions they need to ask about why they should be participating. But think about it and get your flu shot. And you can come to my Facebook page and I will talk to you to death about why that's important.
Excellent.
And what I know about it.
Excellent.
And that we are a part of the planning and the research. We are not just the guinea pigs. That is not who we are anymore.
No, we're not. We're making it happen. I'm coming. Thank you so much, Dr. T. We want lots and lots and lots and lots of Dr. T's in every community, everywhere. We need you everywhere. Sis Byllye, give us your thoughts about where you want to see us.
Well, before I do that, I just have to mention that we did not mention the word domestic violence, and my heart goes out to the women that's been stuck in the house with these men doing all mean abusing partners all during this time, because it's hard being in the house just with your regular life going on and then having that kind of tension. Anyway, the thing that I am so excited about is the political power that we are amassing. We are finally getting into it. Black women are running for office. Black women are getting elected. Black women are judges. I can remember the year when the super spreader got elected. I think there was 9 Black women judges were elected in Alabama.
Yes.
It was like, oh my God. So we have to start infiltrating this, get elected, run for office. You don't need to know everything. There's a lot you can learn on the job. You got to have the heart to be in there. And from the examples of leadership that we've seen, anybody can be a president. Anybody can be the president. So it's no longer that big old lofty thing that's like way all off there somewhere.
How about that?
Bring it on in. And we are the ones we've been waiting for. And I'm saying the Black women run, and I always use the example. Mabel Thomas was 19 years old when she was in the Georgia legislature in the 80s. In the 80s.
Yes.
Saying, it's a remarkable story.
Do it. Young people, run for office.
One of the first people to endorse Congressman Lewis when he first ran.
Right.
She was also the person who called the meeting that started the whole reproductive justice movement. So let's be clear about when we show up, what we do. I hear that. And a young sister on a call last week said something that just stamped in my soul. She said, yes, in the context of where we are today under voter suppression and all of that, she said, yes, today we vote, tomorrow we run.
All right.
I know that's right. And that's where I think we're going to have to lead this. I am so excited, but I do have my brand new next, because I designed t-shirts in my mind, and then maybe I make them and wear them. But I now have our new one for today, which I'm understanding is Build Black Better. Hey,
all right.
Thank you so much, Dr. Terrilyne Cole and Sister Byllye Avery. We have Marsha Jones with us. I'm Dázon Dixon Diallo. It has been my absolute privilege and pleasure. And now I want to turn it over to Cindy one last time. And thank you all to all of our listeners and joiners for staying with us over time. We're so grateful for you for being with us.
Ashe.
All right, I threw out what I was going to say, because here's what I have to say, what Dr. Cole said. Brilliant ideas come from the community. And we all know we're on this call because we want healthcare to be better for everyone. And brilliant ideas come from the community. Brilliant ideas created the Afiya Center, Marsha Jones' organization. Brilliant ideas created SisterLove, Dázon Diallo's organization. Brilliant ideas created the Black Women's Health Imperative, Byllye Avery's organization. Brilliant ideas created the National Women's Health Network. One of our co-founders is on the chat with us, Alice Wolfson. And brilliant ideas created Raising Women's Voices. And we're poised to freaking make change. Again, we've done some and we're poised to do more. We'll be there. If you can support us right now, you'll help us do even more. This conversation was incredible. The chat was wonderful. Thank you all. Donate nwhn.org/raising if you can, but thanks for the love and support and the wonderfulness of this event.
Give generously.
And often.
Right.
Right.
And I think that's it. So our Zoom host will probably close us down in some sort of Zoom way.
Thank you, Cindy. And
Thank
thanks
you
to the
all.
team for putting together such a great program today.
It was wonderful.
Everybody at the network, y'all are fabulous.
Yeah.
Right. And to our board members, some of whom were able to rearrange their schedules to join live. Thanks to them as well.